So, hello, we are high school students working to raise awareness about carpal tunnel syndrome. And today we have with us Dr. Patel. So, can you please introduce your profession and briefly address what carpal tunnel syndrome is?
So I'm Dr. Patel working for San Jose Kaiser for good 12, 13 years in Bay Area. So we do see carpal tunnel syndrome quite often in our outpatient clinic. Um, the tunnel sits around the wrist area. Um, it's like a band, soft tissue band. Several nerve passes underneath the band. One of the nerve is the median nerve, specifically the median nerve, which starts from the brachial plexus here, travels down, goes to the wrist, especially on the thumb side of the wrist. That's why in what happened is when that band get inflammation for some reason, that nerve which is passing underneath compresses because of the inflammation, and that gets irritated, and that irritation causes the numbness, sometimes tingling sensation in the carpal tunnel, the median nerve distribution, which is again entire thumb, entire index finger, entire middle finger, and half of the ring finger. So like a three and a half kind of a distribution. So pregnancy can cause the inflammation. Some kind of autoimmune diseases can cause the inflammation. If you are typing all day long, that can irritate the nerve. If you are welder, if you are cleaner, that repetitive motion with the machine you are using in the hands can cause the inflammation. So that's about the basic introduction of the carpal tunnel.
What other conditions other than pregnancy can have similar symptoms to carpal tunnel syndrome?
So the hand has another two nerves. One is the radial nerve and the ulnar nerve. So radial nerve passes very close to the median nerve. So radial nerve irritation, ulnar nerve, there is a funny bone sits here, and the compression of that nerve, but the distribution is more on the little finger and the ring finger. So radial nerve irritation, ulnar nerve irritation, diabetes can cause the numbness and tingling sensation in the end of the um, extremities. Sometimes some thyroid conditions can cause it. Vitamin B12 deficiency can cause it. HIV infections can cause some kind of numbness and tingling sensation. There are several other causes. Sometimes idiopathic neuropathy, like where you can not find any major cause behind the numbness and tingling sensation, called idiopathic. There are several reasons.
Do you think there is a certain age range at which adults are at most risk for carpal tunnel syndrome?
So I think in my experience, the age group where people are much more productive making money, like anywhere um, from 20 to 50s, I guess.
So our next question is, are there any conditions that can increase someone's risk of developing CTS?
Whoever uses their hands the most um, would be the risk. I have seen somebody who has a passion for knitting and sewing, and they can also be at risk. Somebody who is again like a front desk receptionist who is working all day long on the computer.
How long does it take to recover from carpal tunnel, or can you recover from it?
It all depends, right? So I have seen some cases where if they stop that repetitive motions, they can make it better. So carpal tunnel syndrome can be mild, moderate, severe category. But if somebody doesn't have choice and they keep working in the same fashion, chances of them not getting out of it is. But in the for example, if pregnancy is the cause behind the carpal tunnel, sure. Once your pregnancy is over, your weight is reduced, your fluid collection in the body got reduced, and then it got resolved, right? So I have seen pregnant patient getting better because they retain body water, right, when they are pregnant, and that swelling on the hands and everything is compressing the nerves.
So during our research on carpal tunnel syndrome, we read that acupuncture is being used as a new treatment. So do you know any other new treatments that are being explored right now for this condition?
Um, Basically, physical therapy, acupuncture, wrist brace, anti-inflammatory medications like ibuprofen, motor, but those are all old remedies. I don't hear any innovation besides acupuncture is the most recent one.
How do you think the pandemic is affecting people's risk of developing carpal tunnel syndrome?
Have you guys read about that and you think it has got an increase?
So what we were thinking is more like younger children and everyone, they're inside for virtual learning, distance learning. So we were thinking,
That age group may have, but you don't see so many young kids with carpal tunnel to begin with. Because it's also age and inflammation and everything also plays a role. So I was, yeah, that's a good way to put it. But in next coming years, you will see more.
so our next question is, what are some medical professionals that can help with preventing, diagnosing, and treating carpal tunnel syndrome?
Family medicine doctors like me, internal medicine doctors, physical therapists, acupuncture, um, hand surgeon when it comes into surgery. When you are really diagnosing somebody, you have to send them for EMG, electromyogram. It's a nerve conduction study that is performed by neurologists actually. So I would also involve them.
In the case that it's not treated by these medical professionals, what do you think is the worst case scenario that could happen to a patient with carpal tunnel syndrome?
So sometimes the nerve is so irritated that it keeps giving them tingling and numbness, and that converting to pain. That pain starts entire hand. The carpal tunnel distribution, as I said, that 3.5. It goes to the forearm, sometimes the elbow, and goes to the upper arm. So extreme amount of pain. Sleep disturbance because of the pain. Eventually nerve not getting recuperated, causing muscle damage and muscle problem, and then weakness of the entire arm or hand.
If someone were to go through this worst case scenario, how would their quality of life change, and could they do anything to treat the nerve damage that happened after it got really bad?
Well, the best way to do it is by releasing that nerve pressure from the carpal tunnel. So the hand surgery would be the good option in those severe cases. That's the only thing I think I can think of.
So we heard carpal tunnel release surgery is a treatment option. What exactly does this entail, and are there any complications, or how does the process look like to get that surgery?
So process of going to the hand surgeon is usually when patient comes here to me, if I think that patient has tried all the conservative management and they need to see the further options, we do send them to the neurologist, remember EMG, electromyogram, the nerve conduction study, and then we decide the severity of the carpal tunnel, and then we refer patient to and confirm, not just severity, confirm, because there are so many other things can cause numbness and tingling sensation, right? So once you confirm the um, diagnosis, you send them to the hand surgeon where surgery will be performed. Like any other surgery, I'm thinking, I'm not a surgeon who does the surgery, but as far as I know, I have seen patients recuperating within like 6 to 8 weeks. And usual complications of the surgery is like any other surgery, infection, um, uh, damage of the nerve, damage of the artery, damage of the muscles, and um, anesthetic complications, very rarely death, right, from the major drug interactions or major infection. So those are the major complications I'm thinking.
So if someone were to undergo this surgery, is it possible to develop carpal tunnel syndrome again after?
Usually not. If the entire tunnel has been taken care of and the median nerve is released, usually not.
So, how would your recommendation for treating a mild case of carpal tunnel be different than your recommendation for for treating a severe case?
So anti-inflammatory medicine like ibuprofen, Motrin, Aleve, naproxen, you can take it for 2 to 3 times a day for good 1 to 2 weeks to relieve the inflammation. And we can also send them to the physical therapy where there are certain exercises they can be taught, and that will be helpful. We have a carpal tunnel brace in our clinic where they can wear it, work, even sleeping, you can sleep with it. So an acupuncture, those are few ways you can treat mild carpal tunnel syndrome. The severe, once they fail the conservative management for 2 to 3 months and then their symptoms do get worse, then they go for the surgery to release the carpal tunnel, to release the median nerve, right?
So, what complications may occur when taking anti-inflammatory medication, or is that mainly for people who may have allergies? Is there any complications that can arise from that?
So the major complications after taking long term, if they're taking it for a week or two, I don't see many major complications. But long term use of anti-inflammatory is definitely kidney failure. Sometimes it affects the liver, mainly kidney. Gastritis or the stomach ulcer would be the main other complications. Sometimes allergic reaction, like anaphylactic reaction, can be also very rarely again, but it happens mostly for the long-term use of anti-inflammatory medicine.
So, how would you recommend that people prevent this condition from happening?
Exercise, eating healthy, managing good body weight, those lifestyle modification, avoiding repetitive injuries, taking rest in between the work, taking breaks, doing hand exercises would be a good idea.
Okay, so that was our last question here. So this concludes our meeting with Dr. Patel. And thank you so
That's
much for
it.
thank you so
All
much for
right.
sharing information with us and the community. And we had an amazing time.
Wonderful. Well, good luck, girls. I'm happy we did it.
Thank you so much.